The knee. Crazy Dr. Krause talking about the knee, Knee. Well, joints, articulations in general, but with a focus on the knee because the knee is a classic diarthrotic synovial joint. That is, it's like almost all of the movable joints in our body, whether it's the temporomandibular joint or the interphalangeal joints or the MP joints between the metacarpals and the phalanges in the hand. They're synovial joints, joint structure where two bones come together. Structural classification, this is on page 98 in Super Simple First Edition. They can be fibrous, where there's no joint cavity and they're held together by dense, regular connective tissue, or cartilaginous. A fibrous joint would be like a suture in an adult skull. Cartilaginous, no joint cavity, held together by cartilage. That's why they're called cartilaginous. And synovial, that's the third structural classification. Fluid-filled cavity, like the knee, a connective tissue capsule, ligaments that connect and support. It's movable, highly movable in some instances, most common type of joint. So know your synovial joints, and to do that, Super Simple focuses on the knee, the functional classifications of the knee, functional classifications of joints, and the knee is an example. It's synovial, structural classification, and it's diarthrotic, freely movable. The other two functional classifications are synarthrosis, immovable joint, again like the sutures that are synarthrotic, fibrous joints, and the amphiarthrosis, slightly movable joints, those joints that have a little movement but are not diarthrotic, freely movable. Some unusual joints that the introductory A&P student needs to know: gymphosis, mandible and maxillary bones. That's where your teeth join those bones. That joint between teeth and bone is called a gymphosis. Gets asked frequently. Suture, those joints in the skull. Symphysis, like the symphysis pubis, that contain fibrocartilage. And then back to the synovial joints, the freely movable ones. We're going to emphasize knee, but the shoulder, the hip, the ankles, the digits, wrists, and those freely movable joints, as you might guess, are frequently injured, so they have more clinical significance than some of the other joints. Synovial joints can be uniaxial, that is, they move in only one plane, biaxial, move in two planes, or multiaxial, so only move in one plane. The elbow is a uniaxial, where the shoulder joint is a multiaxial. And there are 6 types of synovial joints that you need to know. A plane joint, this is on page 100, a plane joint, hinge joint, a pivot joint, condylar joint, saddle joint, and a ball and socket joint like the shoulder or the hip joints. And joints are like levers. There's a little physics. There's chemistry in A&P, in physiology. There's physics when it comes to the skeleton and the musculoskeletal systems. 3 classifications of lever. First class, like a scissors, where the fulcrum is in the middle. Muscles in the body, that's like the muscles in the posterior aspect of the neck, are like a scissors. Second class lever that are like a wheelbarrow, where the fulcrum is the wheel is on one end. Calf muscles, the gastrocnemius soleus complex, the gastroc-soleus complex would be an example of a second class lever around the ankle. And then the most common type of lever in the musculoskeletal system is the third class lever, which is like a forceps or a tweezers. So the biceps brachii flexing the forearm at the elbow. And that, again, is the most common type of lever in the body. And I'd encourage you to go out, find some examples online of the 6 specific synovial joints or types of joints. Remember, plane, hinge, saddle, ball and socket joint, and then the 3 types of levers. Put in animation for levers, first class, second class, third class, and so you can actually see those work. And you need, when it comes to joints, you need to know motions. And this is going to be abduction, adduction, inversion, eversion at the ankle, supination, pronation when it comes to the hand, palm up or in that anatomical position. The hand is supinated with the palms facing forward. Easy way to remember that is supination. It's like you're holding a soup bowl in your hand, supination. Then when you pour out the soup, it pronates. Pour, pronate, soup, supinate, supinate, pronate, dorsiflexion, plantar flexion, opposition of the thumb with the fingers with the other digits, abduction, adduction, abduction, taking away, abduction, 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 taking away from the midline, adduction, taking toward the midline. So abduct, adduct, abduct, adduct, and before you know it, you're doing the floss. So know your motions, and again, a good way to do that is to go out online and look at some animations or some demonstrations of that. Elbow joint. In the elbow joint, you do need to know usually the annular ligament, the ligament that covers the head of the radius, frequently gets tested. And that in a kid, maybe a 3 or a 4-year-old, where the uncle or dad or mom or somebody pulls them up by their hands. Kids love to be swung around by their arms, their upper extremities like that. Many times or sometimes that will dislocate the head of the radius from underneath the annular ligament. So know the annular ligament. And in the hip joint, there is a ligamentum teres. Need to know the ligamentum teres. It's an intracapsular ligament that goes from the acetabulum and inserts in the fovea capitis, in the head of the femur. Remember, the femur's got that ball that goes into the acetabulum? Well, that ligamentum teres helps stabilize that and hold the head of the femur into the acetabulum. Know the ligamentum teres. And then on page 102, there are 13 things that you need to know about the knee joint. Femur, tibia, fibula, quadriceps tendon, patella, patellar ligament, tibial tuberosity, medial and lateral collateral ligaments, anterior and posterior, cruciate ligaments, and medial and lateral meniscus. You need to be able to identify those. And one of the reasons Super Simple emphasizes the knee is it is frequently injured, not just in younger people in athletic endeavors, but accidents in business and industry, on a construction site. Senior population will have knee injuries as well as hip injuries. Joints with an emphasis on the knee. See you next time. Crazy Crafts out.